What is up, everybody? We are live here. This is Dr. Sam Watkins from Movement. What's going on? Welcome to the Physio Coaching ACL Community. This platform was created by the Movement, Rehab, and Performance team to educate, empower, and improve the outcomes of all ACLers. And today we're going to be getting into pain after ACL surgery. Talking about pain management, going into how you can manage your pain early on, because I know it can be tricky. It's a tough one after surgery. But just like usual with these, I do want to make sure that it's clear that this is not medical advice. This is for education purposes. And while I do think there's some really good information for you all out there, make sure you are checking in with your PT or surgeon before applying anything we talk about. Main reason being, every surgery is different, right? Everybody has a different procedure done, and because of that, they have different precautions to protect their new graft, and different surgeons have different precautions based on the kind of things that they do, right? What they've done in the knee. So this is not medical advice. Check in with your PT or surgeon before applying any of this here, but I think most of this will be pretty self-explanatory as we dig into managing pain in the early phases. So let's dig into it a little bit then. So first things first here, I want to make sure we're clear that this is focused on the early stage of rehab. So early on, we're not talking about ear, knee pain, kneecap pain, 6 months into the rehab process, not talking about patellar tendon pain after doing too many heavy squats or getting back to running. This is just early stage post-op pain. And main reason, just to make sure this is all clear here, why I'm separating the two is that if we're talking about some of that patellar pain or patellar tendon pain that you get from doing too heavy of squats or doing too many jumps 6 months in, there is much more specific exercise and rehab and load management that needs to be done at that point versus what we're going to be talking about here. So kind of different ends of the rehab spectrum, but we're talking about week 2 to week 12 after surgery. And so after surgery, there's going to be some pain. You know, it's going to be expected. It should be expected. Hopefully you've worked with a PT that has talked to you about some of these strategies before going into surgery, or hopefully your surgeon has prepared you for the fact that things are going to be sore afterwards, right? Maybe day 1 isn't so bad because you still have the nerve block in, but usually around day 2, day 3, things do really start to get pretty sore. So just so we're on the same page here, if you're having pain after surgery, that is not surprising. That is to be expected. How do we get ahead of it? How do we keep it under control? The main thing I like to share with people early on in the rehab process is that the pain needs to be respected. This is not a push through, dig deep, grind through pain, grit your teeth and suck it up. We need to work within our pain tolerance, because the whole purpose of pain is to let our body, or is for our body to let us know when we are pushing our tissues too hard, right? If you think about an ankle sprain, for example, this is one I like to give. It just makes sense, right? A lot of us have had an ankle sprain. If you haven't, you probably know someone that has, right? With an ankle sprain, you roll your ankle, and oftentimes those ligaments on the outside of the ankle are pretty stressed out. If you were to say, roll it pretty badly and say, oh, screw it, I'm just going to push through, I'm tough, it is not going to speed things up with your recovery process, and it's probably going to slow things down, right? Those ligaments in that situation need to calm down, and you need to progressively build back up and give them time to heal before you get back to pushing things super hard. So same idea with the knee. You were just cut into. They just did a very involved procedure to replace your torn ACL, and tissues need to heal. So everything we do, especially in these early stages, needs to respect the healing process, and with that respecting the pain that you're feeling. Doesn't mean you shouldn't push into any pain. We'll talk about maybe how much you can push into things, but you can't just push through and piss off your knee every time you do your knee bending exercises. So the way I like to think about pushing into pain and balancing rest with work is that we are trying to kind of, in a way, get ahead by pushing in the early phases of the rehab process, right? So the ACL is going to take 9 to 12 months, even if you don't do anything, to heal enough to be able to handle the stresses of returning to sport. If you just sat around for 2 months until your knee felt pretty good again, you still are going to need to wait those 9 to 12 months before you can even consider returning to high-level sport, because that's what it takes for your ACL to mature enough to actually handle those stresses. But at that 9 to 12 month mark, just because your ACL can handle those stresses, if you don't have appropriate range of motion, adequate strength, adequate power and explosiveness, you're not going to be cleared to return to sport because you can't move in ways that are going to actually protect that ACL. Right? The ACL is now strong enough to handle stresses, but we need to be able to have the strength and control and explosiveness to get back to sports and still protect the ACL. So everything that we're doing in this first 1 to 2, 3 months is more kind of getting ahead of the game so that we're not just sitting around waiting for your knee to calm down before we actually start to get your range of motion back, get your strength back, maybe start working on some light power and explosiveness. But with that being said, because it's more just kind of this work that I'm talking about is kind of getting ahead of the game so that you're not extending your whole rehab process, and so you can live your life better, honestly, in the short term too. Prioritizing settling down the knee and getting pain under control is much more of a priority in the first stages of rehab than loading heavy and building strength, when we can't actually even load heavy enough to build strength if we are not letting the knee calm down. So hopefully that's all clear. We're prioritizing getting pain under control and getting your range of motion back, building up strength, being super active are all secondary and are ideal if we can get by, but it really is balancing pushing things, building strength with rest and not aggravating and promoting healing. So it can be a tough balance to strike, especially because everyone's going to experience different amounts of pain. Everybody's knee is going to be able to handle different amounts of stress after surgery. Some people get pain under control pretty quickly, and even if they push it really hard, don't have a flare-up after really pushing their knee into deep flexion early on. Some people, if they push it into flexion a little bit too hard, will have a sore knee for a week. So everyone's process varies a little bit differently, but the underlying theme of respecting symptoms is the same. So just as a general rule of thumb, this applies especially in the early stages, but really kind of throughout the whole rehab process, is some pain, a low level of pain when you're doing your rehab exercises is okay to work into, and actually maybe even beneficial, as long as the symptoms don't increase as you're doing the exercise, and as long as you're not having significantly worse pain later in the day and definitely not 24 hours later. So let's say you're 2 weeks out and you're working on your quad sets that your surgeon gave you on your handout when you left surgery, right? Just working on squeezing your quad and trying to force that thing to contract. And it's like a 1 out of 10 pain or 2 out of 10. It's you feel it, but it's not super painful, something you can work through. Maybe you finish that and you're feeling like, oh yeah, it's a little bit more sore than it was before I did the quad sets, but within 45 minutes, your knee kind of feels back to that same ache that it has been experiencing because you just had surgery. That tells me that amount of pain you pushed into was okay. We didn't overdo it. But let's say you did those quad sets and were squeezing as hard as you can, and that the whole rest of the day, your knee is significantly more sore. And even the next day, your knee is more sore. And you're finding that you can't bend your knee as far as you could at your last PT session because you pushed it too hard. That tells me that what you did is too much. And that means we need to scale back what you did there so that you're not constantly kind of picking at the scab and slowing down the healing process, right? It's not like a literal scab, but it is something, a way I like to think about it, right? If we pick at the scab, it's going to slow down the whole process. So pain elevated the next day beyond baseline is kind of like picking at a scab. All the exercises you do throughout the entire process should not pick at it too much. It's going to happen. I can almost guarantee you throughout your process at some point, you're going to overdo it a little bit, but hopefully it's not overdoing it so much that you're sore for 4 weeks. It's just enough where you maybe overdid it a little bit. So that's kind of the idea there. But if we're talking about how we can manage pain, manage post-op pain in the early stage of rehab, the main 3 things to think about, 3 sections we're going to talk about here are going to be managing swelling, medication, and other supplemental interventions, and then activity. So that includes exercises you could work on, that includes exercises you shouldn't do, that includes how you can manage your loads, manage your stresses, things like walking, so that you're not overdoing it, right? So getting into the first of those 3, we're going to talk swelling for a minute here. And just so you all are clear, in the roadmap, there is a whole section on managing pain that talks about a number of these things in a little more detail than I'm going to go into. But it's a nice supplement to what I'm talking about here. So feel free to check that out. Definitely check out the roadmap if you haven't had a chance. But yeah, getting into swelling. So if we think about after surgery, like I've mentioned, it's a trauma, right? It's a very controlled trauma, but it's a trauma where they have to go through your skin, they get into the joint. It takes a toll. And when we have trauma, our body brings blood to the area to provide the injured site with the cells that are needed to help promote healing. And our body does not do a great job of regulating the amount of blood that comes into that injured area. And it almost is like it flips a switch, and your body's thinking, the more the better. The more white blood cells we can get in there, the better. The more of these healing factors we can get to promote the healing process, the better. Not realizing that having too much swelling causes a lot of discomfort. So I'd say in a lot of people's cases, especially beyond the first couple weeks, if you're having pain, it is potentially because of the swelling, right? That knee joint is just so full. And if we can get the swelling down, pain is often much improved. So the ways that we're going to manage swelling are going to be through ice, compression, and elevation. I'm much more promoting of the second 2 options, the compression and elevation. Ice is helpful, but not anywhere near as much as compression and elevation. So if we can add elevation in multiple times per day, and I'm not talking like laying on your couch with your foot up on a pillow, and this definitely is not sitting at your desk with your foot up on a chair right next to you. For this to actually be effective, your knee needs to be elevated above your heart, right? And so if I'm sitting here and I'm elevating at my desk like I am now here, my foot would need to be like up here even, so that my knee is above my heart, or I'm not actually getting that fluid draining out of the knee. If you're sitting for 4 hours, let's say you go back to work after 2 weeks, and you're sitting at your desk working at home, and your knee's getting super sore after 3 hours, and your foot is just up on the chair next to you, that is swelling driving that symptom, driving that increase in pain, and you are not helping your knee not get full of fluid by keeping it elevated above the ground. It really does need to be up. So early on, especially that first month, I think you should be finding at least 3 times a day to get your feet up at an elevated height for at least 15 minutes. And honestly, that first week after the surgery, you're going to be laying pretty low. Like, just get that thing up. Keep it elevated the whole day. I mean, take little breaks, but like if you're hanging out watching TV or reading or doing whatever, get that foot up, manage that swelling early on. It'll be super helpful. And even beyond the first month, if you stand for 4 hours and you're at a baseball game or something, plan on coming home and putting your feet up for 20 minutes. I promise it'll help. It feels stupid, honestly, after the first week or two, but it really helps you to be more comfortable. And if you're more comfortable, then we can actually push and try to continue improving your range of motion. Make sure we're targeting strength early on, which then gets you ahead in the long run. So yeah, elevation multiple times per day, especially in those early phases, first month. 3 times a day, 15 minutes, get that foot up. Icing, kind of the same idea. The idea with ice is we can promote some closing of the blood vessels that are drawing all that blood in. It can definitely be helpful. First week or so, especially if you have an ice machine that your doctor prescribed, and there's some that are mentioned in the roadmap as well, if you want to look into some of those for yourself. But a couple times a day, 3, 4, 5 times a day, 15 minutes at a time, pop the ice off. Hour or 2 later, pop another ice pack on there, use your machine for like 15 minutes. Also helpful with swelling. It just helps the knee feel better. It's super hot in the knee when there's so much blood in the area. So use some ice, and then consider wearing compression. So you might have left surgery with a long leg compression stocking, full leg from toe up to your thigh for surgery, maybe on your opposite leg. Once your incision is no longer open, right? It's not oozing blood anymore, and maybe the steri strips have fallen off because things have closed all the way. I often will recommend that clients take that compression sleeve that their client gave them, that their surgeon gave them at surgery, wear it on that surgical leg. Just the more we can prevent fluid from coming in, the happier you're going to be. You're going to be able to stand for way longer before your knee starts to hurt if there's compression limiting how much that swelling can kind of pool. So either like a compression stocking that goes from toe up above your knees, or even if you're 2 months out and you find standing hurts after a while, like even just like a basic knee sleeve that goes over the knee joint could be helpful too. But that you got to wait for that until the incisions have closed at least. So managing swelling to me is number one. So compression, ice, elevation, all key here, especially first few weeks, first few months, some combination of those things. All right, number 2. So I mentioned the three-pronged approach to managing pain is going to be swelling, pain meds and supplemental things, and then activity and load management, right? So we talked about swelling, getting into pain meds. When you leave from surgery, you're going to be prescribed probably a painkiller, a prescription painkiller, along with some prescription Advil or ibuprofen, some mix. Surgeons have a different variety of things that they like to provide. And I think oftentimes people will feel pretty good on day 1 and 2 because they still have their nerve block working a bit. But after a couple days, that wears off and the pain really ramps up. And so because pain is spreading pretty good, they're like, I don't want to take these meds. I don't want to take these addictive medications. And I get it. I'm all for it. I actually I feel terrible on those kind of pain meds. The ibuprofen and Tylenol mixture, not so much, but like the opioids, the oxys and Percocets and things like that, when I've had surgeries, feel horrible. But just because you're feeling good day 1 when you have the nerve block in does not mean that day 3, once that nerve block wears off, you should just tough it out. It does not mean that. I highly recommend taking the medications that your surgeon gave you as prescribed. I know that they're kind of optional. It really is just based on your comfort, but the more comfortable that you can be, the more that you can actually work on some of the things that will move the ball forward and get you out of this rough stage of rehab sooner. Because that's the reality here, is that this first stage of rehab is rough, not just because of the pain, that is tough, but also because you just can't live your life, right? And until you can get better range of motion, until you can get your quad working better, start to build some strength, your life is going to be much more difficult when you're crutching around versus if you've built up sufficient quad strength to be able to at least walk around the house without a crutch, right? So take those meds as prescribed. I know it's not fun, but the sooner you can get past this painful stage and feel pretty good on a daily basis, the better off you're going to be. Other options would be things like TENS units. So that is an electrical stimulation machine, and we have one in the clinic that we'll sometimes use with people for helping them get their quad contracting better. And you can buy those for yourself as well. They have electrical stimulation machines that help you work your muscles, but then you can also set them to settings to help manage pain better. So you put the pads on around the knee, and it's a nice kind of a feel-good treatment, right? It just gives your body some nice, warm, tingly sensations in the area where you've been feeling a lot of pain. And it can be a nice break from the constant pain after surgery. So it's not something you need to jump off this live stream from and go buy, but it's something that I would definitely consider to help you manage your pain after surgery. If you just search TENS unit, TENS, you can find one. Electrical stimulation unit, you can find one. There's also some that should be in the ACLR resources tab. So check those out. So yeah, that's two of the three prongs for the three-pronged approach to managing your pain, right? So swelling, pain meds, and electrical stimulation, and then activity, right? I mentioned earlier, activity includes both exercises you can do to help things to feel a little bit better, but it also includes how much we need to limit how much you're doing so that things don't get pissed off, right? So if we're thinking about exercises you could do to help things feel a little better. Swelling, like I mentioned, is a main driver of pain. When we don't move, our muscles aren't contracting, and that contraction of muscles is one of the main ways our body helps us circulate fluid, right? And so that's why when you've been sitting after surgery for a while, your knee starts to throb, right? Not only are you in a position where gravity is now pushing fluid down into the knee, you also have not been turning on those muscles regularly to help promote fluid movement. So more regular movement is going to be great, and that could be something as simple as an ankle pump, right? If you're week one and you're just really laying low, you've got your leg elevated, like I mentioned, right? Hopefully, just regularly pump your foot up and down. Think about squeezing your calf, trying to engage that, try to squeeze your quad. The more we can just get those muscles working to work as a pump, the better. If you are a little bit later down the line of rehab, getting up and walking after sitting for a while can be helpful, right? Every time you walk, those muscles are going to have to contract and push the fluid around and help circulate that, so it's not just sitting in your knee, getting full and getting sore. Just in general, any movement you can do that doesn't cause pain will probably be helpful. And so there's tons of different options here. All depends on where you are in the rehab process, but early on, some just like light contractions, like an ankle pump or a quad engagement could be helpful. If you're a couple weeks in and you're already doing the stationary bike, just some light, gentle spinning can be helpful. But those are the main things. Once we get a little further down the line, isometrics that are a little bit higher intensity for your quad can be really helpful. Hamstring isometrics, if you've got a hamstring graft, can be pretty helpful. But it really early on is more about using movement to manage your swelling. And so get muscles firing, get moving a little bit so you're not just letting blood pool as much. And then we talked a little bit about how much you should be pushing and how hard you should be pushing into your exercises. And just again, that same rule of thumb applies where some pain in the moment while you're doing the exercise is okay. And if you finish and it's feeling like it feels a little worked, that's expected. But if you're finding that your pain is increased throughout the whole rest of the day, even into the next day, it tells you that what you did was too much. That pain that consistently lingers into the next day and results in your knee bending being less comfortable, or your knee straightening being less comfortable, or walking being less comfortable, are all signs that what you did that previous day was too much and is kind of picking at that scab. So some pain's okay, it shouldn't be prolonged, right? It might feel used and worked afterwards, but it should kind of settle down pretty quickly. And so it can be tricky to know how you should scale it back if you find that an exercise is overdoing it, right? And like early on, we're working on trying to get your range of motion back after surgery. And there is another live stream I did a couple weeks ago here talking about early range of motion exercises and some of my favorites. There's some examples in there about how we can give people different range of motion exercises depending on the stage that they are in their rehab, whether they're week 2 versus week 10. Things are going to look a little bit different. And if you check out that video, if you're finding you're having a hard time getting your range of motion back, if you're week 2 and you're doing an exercise that I mentioned, I think I usually like to do with someone in week 10, then you probably need to do a regression. But there are tons of different ways you can work on getting your range of motion back. You can work on getting your quad firing. You can work on getting your hamstrings stronger and also lengthened, less tight, without overdoing it. And you've got to find the right level so that you are not promoting or not allowing things to heal, right? So you got to find the right level. And if you're having pain that lingers afterwards, what you're doing was too much. So if we think about walking though, especially once people get to be about a month out, things are feeling okay, but things can be overdone, right? And if you didn't have a meniscus tear, you could very well be walking at month 1, week 4, without crutches, and you've been feeling cooped up and you're ready to get out, and it's easy to feel like you're good to go and good to kind of just go do normal things because you're feeling good walking around the house and you've also been cooped up, right? And so you're like, oh, it's time to go to a sporting event, time to go meet up with my friends for a drink or for some coffee. And I'm not saying you shouldn't do those things, but if you find that walking to the coffee shop, sitting for 3 hours while you're chatting with your friends, walking back home, you're way sore afterwards, you were doing too much. And using your step count on a watch or on your phone can be a good way to know how we can be within that threshold of what's not going to be overdoing things. And again, I'm not saying you shouldn't go out and have fun. And every now and then, if you overdo it because you're out having fun, that's going to be the case. It's going to happen at some point. But it just can't happen 5 times a week, or the whole process is just going to be much more painful for you, literally and also figuratively, and take a lot longer to get through this early stage of rehab. So track your steps, just kind of keep an eye on those. And if if you found that a 10,000 step day at week 6 is way too much, which it probably would be, keep an eye on it and make sure that you're staying below 7 or 6 or 4, whatever you find is kind of your cutoff before things start to feel worse. Tracking your steps, managing how hard you're pushing in exercises, and if things are causing that lingering pain, talk to your PT. Find some alternatives. There's so many different ways you can work all these different things that are going to be less stressful in certain situations and more stressful. So definitely something to communicate with your PT. And then also movement, right? Manage the swelling, get those quads and hamstrings working a little bit when you're laying around week 1. But those are the main three things. Like I mentioned, there's a three-pronged approach: managing swelling, taking your pain meds, and using things like electrical stimulation. And then number 3 is going to be activity/load management. It's just not overdoing things, moving regularly without making things feel uncomfortable. Well, I hope this was helpful, guys. I think this is it's a tricky one because there's going to be pain. And so oftentimes after the surgery, people are so ready just to get the thing done and like start with the rehab process and start working towards getting past this whole thing, that it can be a little bit of a surprise that there is some pain, just because they've been so focused on like, all right, what's this next step? I'm ready for this next step. I'm not worried about the pain. It's going to be fine. But it's tough. Your knee is going to be sore for a while. And there's a lot of question marks about what to do about it and how much should I do? How much should I push through it? And I hope that these were all things that I cleared up at least a little bit today. So myself and Mika, who I've had some live streams with and who you'll see all over the network as well, are happy to help. If you have any questions, shoot us over a comment on the feed. Hit us up there, and we'll give you some tips on pain management. We are also always available for consults, right? Wherever you are in the world, we work with people all over, and we are happy to work with you. So there is a link on the main menu for a free 15-minute virtual consult where we'll take a look at your knee. We'll talk about your history and give you a sense of how we can give you some ideas about how you can get to the next level. So again, I hope that this was beneficial for you all. If you didn't get a chance to tune into this whole talk, this will be posted on the free webinars tab for you all to check out at your convenience. But again, hit us up on the feed if you have any questions, or shoot us a DM, and we hope to hear from you. Bye, guys. If I can figure out how to end this. There it is. All right, this time, bye, guys.